Hi students, now we are going to discuss about the small condition called obstructive uropathy. So the structural and functional abnormalities of the urinary system that obstruct the normal flow of urine can produce renal disorders. So the obstructive uropathy is mainly caused by congenital abnormalities like pelvic-ureteric junction obstruction and posterior urethral valve, which may lead to irreversible renal damage when there is interference with urine flow. The backup of urine above the obstruction causes hydronephrosis. So here there is structural and functional abnormalities of the urinary system. Okay, because of the structural and functional abnormality of the urinary system, there will be obstruction of the normal flow of urine. Okay, and it will produce eventual renal disorders. So obstructive uropathy, it is mainly caused by the congenital abnormalities like pelvic-ureteric junction. That is, if there is any obstruction at the junction of the renal pelvis and ureter, and also because of the posterior urethral valves, which may lead to, and also there may be any obstruction in the posterior urethral valves, it will lead to irreversible renal damage. That means there will be backflow of the urine, and it will cause some obstruction and finally hydronephrosis. That means there will be fluid retention in the kidney. So the definition of obstructive uropathy is, it is an obstruction of the urine flow at any level along the upper to the lower urinary tract. That means there will be obstruction at any level of the urinary tract. Etiology, there are two categories, that is congenital and acquired. So if it is a congenital obstructive uropathy, there will be because of phimosis or circumcision, it is excision of the skin at the tip of the penis. Then meatal stenosis, excision of the foreskin, that is phimosis. Then meatal stenosis, then pelvic ureteric junction obstruction, then duplex renal system, then neuromuscular bladder dysfunction. If it is an acquired obstructive uropathy, it is because of renal calculi, trauma, tumor and tuberculosis. Then which are the sites of obstructive uropathy? So the obstructive uropathy, the first site is pelvic-ureteric junction stenosis, because of the narrowing of the junction of the upper ureter with the pelvis of the kidney. So pelvic-ureteric junction obstruction is commonly found as unilateral or bilateral stenosis of pelvic-ureteric junction causing hydronephrosis. Okay, there may be unilateral or bilateral narrowing of the junction of the pelvic, renal pelvis and the ureter, which cause hydronephrosis. It can be associated with ectopic and horseshoe kidney. The child is having some other congenital disorders like ectopic kidney or horseshoe kidney. Then pelvic-ureteric junction stenosis may present as flank mass without any symptoms. There is a mass at the flank without any symptoms and with UTI and upper abdominal pain. There will be upper abdominal pain and UTI, but there will not be any other symptoms. The next site is posterior urethral valves. Posterior urethral valves in males only. So the flaps of tissue in the proximal urethra, there will be some tissue mass in the proximal urethra. So the commonest cause of distal urinary tract obstruction, there will be distal urinary tract obstruction in this case. And the symptoms in posterior urethral valve stenosis are dribbling of urine, then or incontinence of urine, then abnormal urine stream, palpable bladder, then recurrent UTI, and vomiting and failure to thrive. The next site of obstruction is uretrovesical junction obstruction. That is junction of the lower ureter and the bladder. Uretrovesical junction. So urinary tract with unilateral hydronephrosis. Here also there will be urinary tract infection with unilateral hydronephrosis and dilated ureters. The ureters will be dilated, but there will be narrowing at the uretrovesical junction. So as a result, the ureters become dilated at the affected site. The next site of obstruction is because of ureterocele. Ureterocele means the ureter swells into the bladder. Okay, that means the ureter will be there will be swelling of the ureter, and it will enter back into the bladder. So in ureterocele, the bladder with cystic pouch with ureters insert, that is there will be insertion of the ureters inside the urinary bladder because of the abnormal dilatation. And clinical manifestations are recurrent UTI, then incontinence, fever, then foul smelling urine, flank pain, then abdominal pain, increased urinary frequency. But there will not be much urine to void. Then urinary urgency, and then dysuria or pain with voiding, then hematuria. The diagnostic evaluation include physical examination. In physical examination, we can palpate the abdomen for the presence of abdominal mass. That is, there will be hydronephrotic kidney. If there is a hydronephrotic injury, if the kidney is hydronephrotic, then we can palpate the abdomen. We can palpate the kidney. Then monitor blood pressure, elevated BP in case of renal insufficiency. Then USG, prenatal USG. Then endoscopy. Then intravenous pylorogram to visualize the blood vessels of the kidney. Then renal scan. Then renal function test. Then management, we can do urinary catheterization to facilitate the passage of urine. Then surgical removal of obstruction. If there is any tumor or any injury, or if there is any stenosis, we can do surgical anastomosis or surgical removal. And it is specific to the type of obstruction, and it consists of removal of the obstruction, re-implantation of the ureters if necessary. In case of stenosis or tumor, we have to re-implant the ureters, and creation of a urinary diversion. There may be some creation of urinary diversion in such cases. Then percutaneous nephrostomy or nephrectomy may be indicated in complicated cases. Then ureterostomy, removal of the ureter, otherwise opening of the ureters and creation of a urinary diversion. So these are the management in the case of obstructive uropathy. Hope you all have understood my classes well. If you have any doubt regarding the topics I have taken today, you can ask me any doubt in the group or individually. So please go through the class, please go through the notes, and please listen to the classes. If you have any doubt, you can ask me. Thank you.